Hello everybody and welcome to my channel. I'm Mariah and today's topic is bipolar disorder. In this video, I will cover everything about bipolar disorder. This video is research based. For the research in this video, I used one article to gather information for this topic. And the article I used was called "What are Bipolar Disorders?" from the American Psychiatry Association website. What is bipolar disorder? Bipolar disorder is a brain disorder that causes changes in a person's mood, energy, and ability to function. People with bipolar disorder experience intense emotional states that typically occur during distinct periods of days to weeks called mood disorders. These mood disorders are categorized as manic/hypomanic or abnormally happy or irritable mood, or depressive, which is sad mood. People with bipolar disorder generally have periods of neutral mood as well. When treated, people with bipolar disorder can lead full and productive lives. People without bipolar disorder experience mood fluctuations as well. However, these mood changes typically last hours rather than days. Also, these changes are not usually accompanied by extreme degree of behavior change or difficulty with daily routines and social interactions that people with bipolar disorder demonstrate during mood disorders. Bipolar disorder can disrupt a person's relationships with loved ones and cause difficulty in working or going to school. Bipolar disorder is a category that includes three different diagnoses: bipolar 1, bipolar 2, and cyclomic disorder. Bipolar disorder commonly runs in families. 80 to 90% of individuals with bipolar disorder have a relative with bipolar disorder or depression. Environmental factors such as stress, sleep disruption, and drugs and alcohol may trigger mood episodes in vulnerable people. Though the specific causes of bipolar disorder within the brain are unclear, an imbalance of brain chemicals is believed to lead to dysregulated brain activity. The average age of onset is 25 years old. People with bipolar 1 frequently have other mental disorders such as anxiety disorders, substance use disorders, and or attention deficit hyperactivity disorder or ADHD. The risk of suicide is significantly higher among people with bipolar than among the general population. Bipolar 1 disorder. Bipolar 1 disorder is diagnosed when a person experiences a manic episode. During a manic episode, people with bipolar 1 disorder experience an extreme increase in energy and may feel on top of the world or extremely irritable in mood. Some people with bipolar 1 disorder also experience depressive or hypomanic episodes, and most people with bipolar 1 also have periods of neutral mood. Symptoms of bipolar disorder are manic episode, hypomanic episode, and major depressive episode. Manic episode. A manic episode is a period of at least 1 week when a person is extremely high-spirited or irritable most of the day for most days, possessing more energy than usual, and experiencing at least 3 of the following changes in behavior: decreased need for sleep, for example, feeling energetic despite significantly less sleep than usual; increased or faster speech, uncontrollable racing thoughts or changing ideas or topics when speaking; distractibility, increased activity, for example, restlessness, working on several projects at once; increased risky behavior, for example, reckless driving or spending sprees. These behaviors must represent a change from the person's usual behavior and be clear to friends and family. Symptoms must be severe enough to cause dysfunction in work, family, or social activities and responsibilities. Symptoms of a manic episode commonly require a person to receive hospital care to stay safe. Some people experiencing manic episodes also experience disorganized thinking, false beliefs and or hallucinations known as psychotic features. Hypomanic episodes. A hypomanic episode is characterized by less severe manic symptoms that need to last only 4 days in a row rather than a week. Hypomanic episodes do not lead to the major problems in daily functioning that manic symptoms commonly cause. Major depressive episode. A major depressive episode is a period of at least 2 weeks in which a person has at least 5 of the following symptoms, including at least one of the first 2 symptoms: intense sadness or despair, loss of interest in activities the person once enjoyed, feeling of worthlessness or guilt, fatigue, increased or decreased sleep, increased or decreased appetite, restlessness, for example, pacing or slowed speech or movement, difficulty concentrating, and frequent thoughts of death or suicide. Treatment and management. Bipolar disorder symptoms commonly improve with treatment. Medication is the cornerstone of bipolar disorder treatment, though talk therapy or psychotherapy can help many patients learn about their illness and adhere to medication, preventing future mood episodes. Medications known as mood stabilizers, for example, lithium, are the most commonly prescribed type of medication for bipolar disorder. The medications are believed to correct imbalance brain signaling. Because bipolar disorder is a chronic illness in which mood episodes typically reoccur, ongoing preventive treatment is recommended. Bipolar disorder treatment is individualized. People with bipolar disorder may need to try different medications before finding what works best for them. In some cases, when medication and psychotherapy have not helped, an effective treatment known as, sorry if I say this wrong, electroconvulsive therapy, or ECT, may be used. ECT involves several rounds of a brief electrical current applied to the scalp while the patient is under anesthesia, leading to a short controlled seizure. ECT-induced seizures are believed to remodel brain signaling pathways. Since bipolar disorder can cause serious disruptions to a person's daily life and create a stressful family situation, family members may also benefit from professional resources, particularly mental health advocacy and support groups. From these sources, families can learn strategies for coping, participating actively in treatment, and obtaining support. Bipolar II disorder. A diagnosis of bipolar II disorder requires someone to have at least one major depressive episode and at least one hypomanic episode. People with bipolar II often first seek treatment as a result of their first depressive episode. Since hypomanic episodes often feel pleasurable and can even increase performance at work or school, people with bipolar II, disorder frequently have other mental illnesses such as an anxiety disorder or substance use disorder, the latter of which can exacerbate symptoms of depression or hypomania. Treatments for bipolar II are similar to those for bipolar: medication and psychotherapy. The most commonly used medications are mood stabilizers and antidepressants, depending on the specific symptoms. If depressive symptoms are severe and medication is not effective, ECT may be used. Each person's treatment is individualized. cyclomic, I think it's cyclomic disorder, and I'm sorry if I said that wrong, is the milder form of bipolar disorder, involving many mood swings with hypomania and depressive symptoms that occur frequently. People with cyclimia experience emotional ups and downs, but less severe symptoms than bipolar 1 or 2 disorder. Cyclothymic disorder symptoms include the following. For at least 2 years, many periods of hypomanic and depressive symptoms, but the symptoms do not meet the criteria for hypomanic or depressive episode. During the 2-year period, the symptoms or mood swings have lasted for at least half the time and never stopped for more than 2 months. Treatment for hypothalamic disorder can involve medication and talk therapy. For many people, talk therapy can help with the stresses of mood swing. Keeping a mood journal can be an effective way to observe patterns in mood fluctuation. People with chlamydia may start and stop treatment over time. I hope you enjoyed this video. As always, I'm open to any suggestions you have for any future video topics. Please let me know what they're in the comment section below or on my Twitter page. And my Twitter handle is @BurleyMariah, and I can spell it for you, @BurleyMariah, and that's my last name then my first name. The next video will be on World Suicide Prevention. And I know that's probably going to be filmed for October, but that actually is for the month of September. I hope that everyone's continuing to stay safe. I'll post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified for when I do any live streams or upload any new content, you're going to want to click the bell icon. And under the bell icon, you're going to want to click the all options. Thank you for watching. I love you guys. Bye!